fats in your body say, okay, we are here, utilize us. The only way fat can come into utilization is the insulin levels must drop. So the insulin levels are now low because you're not eating. When your insulin level is high, you store energy. When your insulin levels are low, you pull energy out of the fats. So now through the hormonal action of, hormone-sensitive lipase and the action of LPL, what happens? The fat stores open up because your insulin level is low. So the fats start being devoured, the fat gets converted to triglycerides and fatty acids. The fatty acids flood the bloodstream. You can't utilize fatty acids, so they go to your liver. And in the liver, your fatty acids get converted to ketones. There's two ketones, beta-hydroxybutyric acid and acetoacetic acid. These two ketones now go up. Ketones can be utilized by the body. And this is the great breakthrough that I want to tell you, that ketones can be utilized by every cell of your body, including your brain. You are told that the brain is an obligate glucose utilizer, can only utilize glucose. It's absolutely wrong. There was a study done in Britain where what they did is that they brought the blood sugar down to 30, but they pumped the patient full of ketones. And they were all sitting and talking and having fun and not a sweat. The only one that was sweating was the doctors. So blood sugar, you should be having convulsions. The brain can utilize ketones. After a 7-day fast, 70%, up to 70% of the energy utilization of the brain is through ketones. And the brain likes it. And there's even studies to show that when the brain utilizes the ketones, it actually is a cleaner burn. It burns more cleanly. So what happens is there's a slow increase in the ketones, which actually starts around 18 hours and gradually goes up, 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 up. So by 24 hours, you have some ketones, maybe 10, 15% of your entire energy source is now going to be ketones. How are you going to feel with ketones? Just fine. No problem. You feel okay. Because ketones are giving you all the energy that you need. Then, let's say another 12 hours go by. So you're now at 35 hours, let's say. Now the ketones go even higher and higher and higher. And by 3 days, your ketone levels are really beginning to get even better and even higher. So by the 5th day of fasting, you will have a lot of ketones. Now you can measure your ketones in your urine. So you get a little dipstick, and you can buy this, by the way, it only costs a few dollars, and you just test your urine to see when you become ketogenic, and you can test it. Now, if you've been on a low carb diet, low sugar diet, you will go